Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on frozen shoulder, so let us discuss what it is. Frozen shoulder, also called adhesive capsulitis, involves stiffness and pain in the shoulder joint. Signs and symptoms typically begin slowly, then get worse over time. Symptoms gets better, usually within 1 to 3 years. Having to keep a shoulder still for a long period increases the risk of developing frozen shoulder. This might happen after having surgery or breaking an arm. Treatment for frozen shoulder involves range of motion exercises. Sometimes treatment involves corticosteroids and numbing medications injected into the joint. Rarely arthroscopic surgery is needed to loosen the joint capsule so that it can move more freely, such as Bankart procedure is being given. It's unusual for a frozen shoulder to recur in the same shoulder, but some people can develop it in the other shoulder, usually within 5 years. So, what are the symptoms? Frozen shoulder typically develops slowly in 3 stages. Number one is freezing stage. At any movement of the shoulder causes pain, and the shoulder's ability to move becomes limited. This stage lasts from 2 to 9 months. Then, second is the frozen stage. Pain might lessen during this stage. However, the shoulder becomes stiffer. Using it becomes more difficult, and this stage lasts from 4 to 12 months. Then is number third is thawing stage. The shoulder's ability to move begins to improve. This stage lasts from 5 to 24 months. For some people, the pain worsens at night, sometimes disrupting sleep. What are the causes? The shoulder joint is enclosed in a capsule of connective tissue. Frozen shoulder occurs when this capsule thickens and tightens around the shoulder joint, restricting its movement. It's unclear why this happens to some people, but it's more likely to happen after keeping a shoulder still for a long period, such as after surgery or an arm fracture. What are the risk factors? Certain factors may increase the risk of developing frozen shoulders, such as age and sex. People aged 40 and older, particularly women, are more likely to have frozen shoulder. Immobility or reduced mobility. People who have had to keep a shoulder sometime still are at higher risk of developing frozen shoulder. Restricted movements can be the result of many factors, including rotator cuff injury, broken arm, stroke, and recovery from surgery. Then systemic diseases. People who have certain diseases appears more likely to develop frozen shoulder. Diseases that might increase risk include diabetes, overactive thyroid, hyperthyroidism, underactive thyroid, hypothyroidism, cardiovascular diseases, and Parkinson diseases are involved. What is the prevention? One of the most common causes of frozen shoulder is not moving a shoulder while recovering from a shoulder injury, broken arm, or stroke. If you have had an injury that makes it difficult to move your shoulder, talk to your healthcare provider about exercises that can help you maintain your ability to move your shoulder joint. Now, what is the diagnosis? During the physical exam, a healthcare provider might ask you to move your arm in certain ways. This is to check for pain and see how far you can move your arm, active range of motion. Then you might be asked to relax your muscles while the provider moves your arm, passive range of motion. Then frozen shoulder affects both active and passive range of motion. Frozen shoulder can usually be diagnosed from signs and symptoms alone, but imaging testing such as X-rays, ultrasound, or MRI can rule out other problems. What is the treatment? Most frozen shoulder treatment involves controlling the shoulder pain and preserving as much as range of motion in the shoulder as possible. Then what are the medications being given? Pain relievers such as aspirin and ibuprofen, Advil, Motrin, IV, others can help reduce pain and inflammation associated with frozen shoulder. Sometimes warning can be given. In some cases, a healthcare provider might prescribe stronger pain relieving and anti-inflammatory drugs such as naproxen or diclofenac sodium. Then the role of therapist. A physical therapist can teach you the range of motion exercises to help recover your shoulder. movement. Your commitment to doing these exercises is necessary to regain as much movement as possible. Then surgical and other procedures are also other ways to cure this disease. Most frozen shoulders get better on their own within 12 to 18 months. For severe or persistent symptoms, other treatment include steroid injections, and injecting corticosteroids into the shoulder joint might help decrease the pain and improve shoulder mobility, especially if given soon after frozen shoulder begins. Then hydrodilatation. Injecting sterile water into the joint capsule can help stretch the tissue and make it easier to move the joint. This is sometimes combined with a steroid injection. Then is shoulder manipulation. This procedure involves a medication called general anesthetic, so you will be unconscious and feel no pain. Then the care provider moves the shoulder joint in different directions to help loosen the tightened tissue. Then the surgery. Surgery for frozen shoulder is rare, but if nothing else helps, surgery can remove scar tissue from inside the shoulder joint, and this surgery usually involves making small incisions for small instruments guided by a tiny camera inside the joint, which is called arthroscopy. Then lifestyle changes and home remedies. Continue to use the shoulder and arm as much as possible, giving your pain and range of motions limits. Applying heat or cold to your shoulder can help relieve pain. Then alternative medicines are acupuncture. Use hair thin flexible needles put into the skin at certain points on the body. Typically the needles remain in place for 15 to 40 minutes. The needles are not generally put in very far. Most acupuncture treatments are relatively painless, but allopathic medicine do not recommend acupuncture uh, treatment for frozen shoulder. Then there is nerve stimulation. A transcutaneous electrical nerve stimulation (TENS) unit delivers a tiny electrical current to the key joints on a path that a nerve follows. The current delivered through electrode tapped to the skin is not painful or harmful. It is not known exactly how TENS works. It might cause the release of molecules that curb pain, endorphins, or block fibers that carry pain. Then preparing for your appointment, you might first see your primary care provider. In some cases, you may be referred to a doctor who specializes in treating bones and muscles, orthopedist or psychiatrist. What you can do before your appointment: be prepared with a complete description of your symptoms and when they begin, information about medical problems you have had, information about the medical problems of your parents or siblings, the names of all the medications and dietary supplements you take, and question to ask the healthcare provider. Then what to expect from your doctor: be prepared to answer questions such as what worsens your symptoms, have you ever injured that shoulder? If so, and how? And do you have diabetes? Have you had recent surgeries and or had to keep your shoulder still for a time? So it was all about the frozen shoulder, and I hope so that you would have liked this video. If you have liked this video, then share this video with other individuals as well, and subscribe to my channel, and have a wonderful nice day. Thank you for listening this video. Thank you very much.